We are very pleased to have Bill come with us. And I'd like the first few minutes of our talk with you this morning, Bill, the few minutes that we have, to begin a little bit with the book. You say it's a model, it's not applicable in all cases, you tell us, but it's a model for how problems without apparent solutions can in fact be solved through the application of the theoretical framework in this book. So I'd like to start my first question for you, Bill, this morning, and welcome from your office in New York. Welcome. Bill, why did you write this book? Could you please give us a little background and talk to us a little bit about what's in it?
Well, let me use the opportunity that I have to speak to first compliment you, Tom, and your whole team at the Global Center in Brazil. Columbia took a different path from other universities at the start of the century and decided not to build campuses around the world, but to build research and outreach and convening centers in key cities around the world. And we have 9, I believe, at this point. Is that correct?
That's correct.
All over the world, from Beijing to Santiago to, I guess, Rio, Sao Paulo is kind of a twin city in Brazil. And I could say without reservation, having dealt with all the centers, by far the best one is yours. Does the most, has the most impact, has done the most for the society. So I've been honored and lucky to play a part. And it does lead into the book. Howard is, as some of you may have guessed, the grandson of Warren Buffett. So a person who grew up in a household that has really changed the world. And what Warren Buffett's theory in the private sector is that if you put together businesses that were synergistic, businesses like insurance and railroads and manufacturing, and you use those synergies, you could accomplish much more than having individual businesses that had no connection to one another. So it wasn't, in the business world, the first conglomerate by a long run, but it was the first conglomerate that thought about intersections between the different businesses it was involved in. And as many of you know, it's been ridiculously successful. Howard came to, the grandson came to be my student here at SIPA. We got to know each other really well. He is much more interested in foundations and the NGO sector. As you pointed out, Tom, my background has been more from the governmental side. And we started to think, you know, if the public sector and the private sector and the social sector collaborated, they could accomplish much more, similar to Berkshire Hathaway in the private sector. They could accomplish much more than government or the social sector could on their own to solve what appeared to be insoluble problems. And in the course of our research, we looked all around the world. People who have a chance to look at the book will see, maybe surprisingly, that 2 of the countries that are featured in the book are India and Brazil. 2 so-called developing places. And the other country that has a prominent role is the United States, and particularly New York City. And we found in India a program called Aadhaar and telemedicine as changing the world. And maybe we can talk a little bit about that later, because telemedicine could play a great role in the crisis that we now face. And in Brazil, we saw a experiment run by Comunitas, which is a social organization, working with governments to help improve local governments around Brazil. It's called Juntos. And it's been extraordinarily successful. So we saw models of collaboration across the sectors in Brazil, in India, and right here in New York. Many people probably don't know that Central Park, which is now the home of a pop-up hospital, sadly, but also positively, was one of the most dangerous places in New York City when I was first a public official. It's now one of the safest. It's the most visited park in the United States. In the summer, 250,000 visitors. It's a public park open to everybody, no matter where they're from, but it's run by a nonprofit organization. And most of the organizations that maintain it are private. So the motivation of the book was that we could deal with things like healthcare and healthcare for all, education for all, better public transportation through cross-sector collaboration. And it brings us back to the crisis that we have right now. And I think the solution, or the path through this pandemic, is cross-sector collaboration.
Thank you very, very much, Bill.
Sorry.
Yeah. That's
obviously I care about this a little bit.
No, it's great for that introduction, that framework on social value and public-private partnerships. You know, we'll get back to this point of the proper role of government now and in the future, how this crisis changes our understanding. I think your framework is flexible enough to encompass the evolution of private-public partnerships going forward. Just a small note before we move back onto the situation in the United States, the management challenges in the United States, is the Comunitas, the NGO in Sao Paulo that you mentioned and you highlight in your book, is kind of leading the way now in providing, raising funds in the private sector to provide emergency equipment to the public hospital system in Sao Paulo, which is under siege, as you know, and at risk of being overwhelmed. So you were prescient in selecting that organization and highlighting it, and it's still continuing to do good work in this crisis. But Bill, I think we'd like to now turn to the COVID crisis in the United States from a management viewpoint, Bill, for you as a manager. And I'd like you to compare, maybe tell us how this caught the U.S. so badly prepared. The U.S. has all the resources in the world, the finest infection specialists in the world, and our Centers for Disease Control and throughout our research system in the United States. We had warnings. There's an article in today's New York Times, Bill, that in 2019, President Trump's own economic advisors warned, and we weren't prepared for a pandemic. So, Bill, why was the U.S. Off to such a bumbling and late start, which is going to inevitably cost lives? And is this inevitable in a crisis that leadership delays a bit to take action? And do you think they're getting it right at the federal level? Before we talk about New York City, New York State, at the federal level, are things in the U.S. finally beginning to head in the right direction from a management perspective?
Well, it's a very challenging question. And I think one of the things we all need to think about in this situation is there are a lot of conflicting interests, right? So one, we have politics, right? And the great part of a democracy is that people get to choose their government. The bad part of that is politicians are focused, yes, on doing the right thing, but also getting reelected and being popular and having public support. And quarantining people in their own homes and putting people out of work and isolating people, even if it's to save their lives, is not popular. People don't want to stay home. Many people can't stay home. They need their jobs. And when you close economies down, they lose their jobs. So I think in Washington, the reaction there was the economy comes first. We're in an election year, right? Politicians in the US are usually judged primarily on the state of the economy. And scaring people about a pandemic and taking preventive action, which has negative economic consequences, is not something that politicians tread on lightly. And I think as a contrast maybe to China, one of the things we should think about, which is not a democratic country, and there are people who say China waited too long. All those things may be true. Maybe China's data is not accurate. That could be true too. But as a non-democratic country, once they realized they had a serious problem, they locked it down. They locked down Hubei province. They locked down Wuhan. And in many respects, maybe not forever, but they stopped the pandemic in its tracks. So that's a unitary, non-democratic, very powerful government. Even if you look at other less authoritarian governments in Asia, Taiwan, Hong Kong, Singapore, South Korea, they've had much more success so far in fighting the pandemic because they are more unitary. Even if they have three sectors, the sectors are dominated by the government. So back to the United States and your question, not only are we democratic, not only are we political, but we are very decentralized, right? So our states and our city governments have a lot more power than they do in Brazil, for example. And typically, an issue like this would be dealt first at the local level, then at the state level, and then at the national level. That's our culture, that's our organization. And the pandemic, unlike maybe some other kinds of events like a war, which might affect everybody in the country at the same time, the pandemic is localized. So I think part of the slow Washington to act was also reflective of the fact that first, it was only in Washington State, and then Washington State and New York. So again, could they have had more foresight? Could they have exercised more leadership? Yes, I think they could have and should have. But we're where we are now, and I think despite how difficult the next 2 weeks will be, there's a bright light in all this, and that is my old friend, Governor Andrew Cuomo, who has risen to the occasion, and in the hottest spot in the United States, and maybe at this point, the hottest spot in the world, I think we're doing pretty well. I mean, I know that's a hard thing to say.
But if we just finish quickly on President Trump, all the Brazilian listeners with us this morning know that President Trump has, whether he knows it or not, has an outsized influence on the president of Brazil. And I think President Trump has, in your judgment, Bill, just to finish this quickly on his plan, has President Trump definitively listened to his scientists now, or do you think there's going to be some backsliding and an urge to restart the economy prematurely, even at the cost of human lives? Do you think he's really turned the corner?
Well, Tom, you know me really well. So you know I'm repressing my great desire to express my opinions about President Trump, who, as former housing czar of New York, I've known President Trump very intimately for a long, long time. And let's just say, he's not in my my hall of heroes. So we'll leave it at that.
Let's leave it at that.
I would say on the defense of him, he has worried and been worried very much about stopping the U.S. economy and the consequences that would have, yes, for him and his political career, but also for the country as a whole. And I think that's a legitimate concern. And I think that concern led him to maybe look at the world through rose-colored glasses. He didn't listen to his experts, and that has cost us and will cost us in lives. Has he gotten the message? I think so. Yeah. I think so. We are now nationally locked down, if you will, for 30 days. Yeah. The president had been talking about reducing all restrictions by Easter Sunday. He has backed off of that. And so I think he's listening. Will he lose his way again? Yeah, I think as we get further and further into April, and if, God willing, we reach an apex here in New York and the number of cases starts to decline, I think his ability to hold to the 30 days will dissipate, and that would not be good.
Bill, thank you so much. Let's go then to the state of New York. Just to remind people joining us late, many people still coming on the call. Bill was the housing czar for the state of New York, a very senior official, very with weighty responsibilities, also a senior civilian official in the New York City Fire Department. He studies New York, he lives in New York most of the time. New York is in the eye of the storm. Bill, could you talk about a little bit more about why you find Governor Cuomo to be, maybe he is in that Hall of Heroes, at least preliminarily, in terms of dealing with this crisis? What is it he's doing as a leader that you like, and maybe what are the things he ought to be doing but isn't yet? What should be looking around the corner? What Governor Cuomo? Let's look at Governor Cuomo first, or Mayor de Blasio. Let's focus on Governor Cuomo. What should they be worried about? What's around the corner? What should they be worried about next?
Well, I shared with you earlier today a brief piece that I wrote along with one of my colleagues here at Columbia, Steve Cohen, and one of the people in my Hall of Heroes, Chief Joe Pfeiffer, who's now teaching here at Columbia, but was the incident commander at September 11th, 2001. a man who has been the commander at crises on the ground during Hurricane Sandy, the Ebola crisis, many other things. And in our piece, we talk about principles of good leadership in times of crisis. And there are really several, but the three I would highlight are communication, collaboration, and coordination. And I think if you look at what Governor Cuomo has done and why I think he's been successful and why his recent approval ratings are over 80%, is every day between 11 and 12, he gets on TV and spends an hour using a PowerPoint like a professor, taking us all through what's going on. What are the facts? What do we know? How many people have been admitted? How many people have been tested? How many people are serious? What's our status of masks and gowns and gloves and ventilators? Who are we talking to? And I think one of the great points, the second one, right? Collaboration, as you mentioned, Communitas working with government. The governor recognized, which you would think, geez, we should know this, right? We have a public hospital system and a private hospital system. In both systems, hospitals operate as independent entities. They don't really talk to the other public hospitals, and the privates don't talk to the privates, and the systems don't talk to each other either. So we had a well-known crisis at Elmhurst Hospital, a public hospital in New York. We have 11 other public hospitals and multiple private hospitals in New York City and around New York State. So yes, they had problems, but not blaming them, but we didn't develop a systematic approach. They didn't think to say, let's call some of the other public hospitals. Let's call neighboring private hospitals. Let's call the governor. You know, they kind of tried to survive as a field hospital would do in a military situation. So the second point I would say about the governor, communicate, collaborate. He's started to treat the hospital systems in New York as a system and get them to work together, help them work together, supply them. One of the big things we're talking about now is, God willing, this crisis passes in New York, the key shortage of equipment, ventilators, but even masks and gowns. The governor's already committed to send them to the next hotspot. So not going beyond collaboration among the sectors in New York, think about the whole country. And so that's, and then the third point that I give him thumbs up on is coordination. So he started to move. He has been working with President Trump. We have a 1,000-bed hospital boat that is now in New York, which the president made available to us, and it's now taking people, not virus people, but taking people who would normally be in the hospital, moving them there, the ones that are in less dire circumstances. Mm-hmm. Mm-hmm. Same thing, they set up basically what I would call an Army field hospital in our Javits Convention Center. Mm-hmm. So we have several thousand new beds in New York as part of the governor coordinating with the federal government to bring military resources to New York to help in the crisis. So he gets high marks on all this. You said, is everything perfect? And the answer is no. I think the governor often falls into, he can be prickly, as some leaders are, and he gets prickly with other people like the mayor. The mayor and the governor here in New York don't get along all that well. And in fact, there was a editorial in one of the newspapers today here in New York saying, you know, basically, hey boys, isn't it a time you learn to play together?
Yes. Yeah.
So maybe that'll happen. But
that's what's interesting, Bill, and thank you for those remarks about Cuomo. A lighter question on the lighter side. Now people are starting to say he should run for president, Bill. What do you think of Andrew? Is that just something that people say at a time like this because he's showing leadership, or is there something to that?
Well, I mean, the governor of New York is an important player no matter who he is. Same for California, Florida, Texas. I would argue that governors potentially make great presidents because they have executive experience. Yeah. Typically, we pick our presidents from the legislature.
Yeah.
It's fine, except legislators don't run anything. So they know a lot about policy. They know a lot about politics.
Yeah.
They don't know a lot about administration. So would he potentially make a good president? I think he's got the tools. But I think we're, as you do know, we're very late in our process. So we're going to have an election in November, God willing. President Trump will run for re-election. Joe Biden, a former senator, looks like he's pretty much locked up the Democratic nomination. And he's already committed to himself or to us that if he is the nominee, he will pick a woman as vice president, which I also think is about time. But I could imagine him appointing Andrew Cuomo as the national housing emergency management super czar of various crises that we face, not just the pandemic, but we face an affordable housing crisis, a healthcare crisis, an education crisis. Maybe we'd have a crisis manager in chief, and it'd be Andrew Cuomo.
Very good. We could do worse than that. Bill, I want to kind of start toward wrapping up and then listen to a few questions in the small amount of time we have with you before we have to run off and teach class online. But Bill, finally, I wanted just some brief reflections. I have a big question, and I'll give you a small amount of time to answer it. But how does this pandemic and the public policy challenge it presented change U.S. views, and for that matter, global views on the proper role of government and the private sector going forward? Is this a sort of a watershed moment for the state, for public manager, for the public sector, that really when a crisis, it's all well and good to be neoliberal or to promote the market economy, but at times like this, you got to throw away some orthodoxies, and the state and the government has to take over. Or once this pandemic passes, we'll be back to business as usual, sort of a tension between how much interference of the government is proper and how much is too much or too little. Bill, could you maybe just talk a little bit about the balance in that public-private partnership, which is so much the subject of your book going forward?
That's why you're so brilliant, Tom. That's probably the hardest question anybody ever asked me in my whole
30
life.
seconds, please.
Yeah. Well, if we look back at history, we can see that even in a very private sector oriented society like the United States, some would argue the most privatized economy in the world, that during the Great Depression, the Second World War, after 9/11, you see the national government asserting itself much more strongly in society than during what we might call normal times. And we see that now. Even President Trump has directed General Motors to work with General Electric to make ventilators. I mean, ordered, not asked, ordered. And he has the legal authority to do that. So will we back off again when the crisis passes? Yeah, I think we will. But I think, again, to full circle back to the book, government doesn't have to take over. It needs to partner and collaborate. So, you could easily, if you establish better lines of communication, collaboration, and coordination, you don't necessarily have to order people. And some would argue, if you look at Japan or South Korea or Taiwan or maybe less so Singapore, but maybe Hong Kong, that there is more of a collaborative attitude and history between the sectors. And maybe that's more of a model for us here in the US to follow.
Thank you very, very much, Bill. We're coming to the end of our the opening segment. We're going to have about 10, maybe 15 minutes for questions, which Laura is going to field and pass on to you for people along the line to write their question in English or in Portuguese. We were going to talk a little bit, Bill. You've already kind of anticipated this wrap-up question, which is how you look at Brazil and Brazil's public policy response in that. There's so many eerie parallels, as you mentioned. That was your word. The president kind of in denial and wanting the economy to keep chugging along, fighting with the governors, fighting with the scientists, sending all sorts of missed signals. And at the same time, the states, but some important differences. The states, you say here in Brazil, and municipalities, and you're certainly correct about this, with much less power to confront the pandemic than, say, New York State or California or other U.S. States. But do you have any other just observations from your vantage point, Bill, that you would add to that? I mean, what should Brazil, with far fewer fiscal resources to throw at this problem, in a sort of a zero-sum world where Brazil can't count on getting large amounts of aid from the United States or Europe or China or wherever, what's your assessment from afar?
Well, as you know, I love Brazil. It's a place that's a very big part of my life and has been, thanks to you. And there are many things to like about the way Brazil is organized. A powerful national government can be helpful in a big country. And the national government in its history has done some good things in recent times. I mean, I see Brazil as a leader in Bolsa Familia, in providing help to poor people, in expanding healthcare for poor people, the clinics and the e-medicine. But I guess there are a couple things I would say. One, I do think that the national government needs to do more. I do think the president of Brazil needs to take this more seriously as a greater threat than he has so far, just like President Trump has, it appears. So maybe he'll follow suit. I hope so. I think telemedicine has a great potential. Here in New York Presbyterian Hospital has seen the number of interactions through this kind of connection between doctor and patient increase 15-fold since the beginning of this crisis. And you could think about it, right? You can diagnose, you can send medicine, you can keep people out of the hospital system, you can keep track of people. I think Brazil has been trying to innovate in healthcare. It has done some. I think the next step is telemedicine, a really deep commitment to that. I think that would be very helpful. And the technology, we have the technology to do this. Doctors and patients all over Brazil could be doing this. I understand that there are internet connections and problems, but not in the big cities. So that's one thing I would look at right away. And then the other thing I would come back to is the incredible role that Communitas has played, and Lehman Foundation and other foundations in Brazil, people in the private sector who have really taken up the mantle to try to make education better, to try to make local governments better. I think as much as they have done, and they've done so much, I think they need to redouble their efforts and use their influence with the government to get the government to do more. Yes, government doesn't have unlimited resources, but in every society in the world, the government dwarfs the private sector. Even in the United States, right, as big as the private sector is, 50% of the US economy is government. So you're never going to solve a crisis in any place around the world without the government.
Thank you, Bill. That's a great reply, a great way to kind of finish up the presentation. It's wonderful having you. We're going to turn back to our organizer-in-chief, Laura Nora, there in Niterói. And Laura, if you've got some questions on the line that you have had time to filter and pass on to Bill, go ahead.
Sure. Bill have received a few questions here, and so I'll start with one that is asking you, how does government effectively collaborate with private companies in the time of severe crisis without disturbing the natural flow of the market forces? In other words, can governments pick winners and losers on this choice?
Again, kudos to the questioner. An extremely good question and a hard question to answer. And so that's the balance we're dealing with right now. So, for example, the president has ordered General Motors to make ventilators. It's not their business. It creates difficulties for them. On the other hand, they're using an auto plant that they had closed down. So it's not necessarily disrupting their regular business. They will get paid. They will make money. It does put people to work. It's a very delicate and difficult challenge. And if people look at what's going on in the United States over the last 45 days or so, they'll see what a difficult balance this is. Government has a responsibility to take care of everybody in the society. And healthcare, life and death comes first, but the economy's number two, right? This will subside. And right now it's April 1st. Most of the people who live in the city of New York owe their rent. They're not working. They can't pay their rent. Landlords need the rent to pay for so inevitably in crises, the line between the government and the private sector necessarily blur. And so, yes, the government needs to disrupt to some degree. But on the other hand, I would say they need to compensate. So our listeners and viewers may have seen the Congress just enacted and the president signed a $2 trillion bill, which provides money to people to pay their rent. It provides loans to big and small companies to meet their payrolls. So I think it's an ebb and flow. I think it's a collaboration. It is a partnership. But in the end, public safety comes first. So, and as Tom and I discussed earlier, I suspect that the government, our government at least, will pull back once the crisis subsides. But necessarily, there has to be collaboration. And if there's not collaboration, there has to be mandatory collaboration, if you will.
Thank you, Bill. I will also enjoy the opportunity. As you mentioned, we have another question here for Carlos that is asking, do you see the effects of this crisis leading to a strengthening of central government in the US and weakening the autonomy of state and city governments?
No, I don't think so. I actually think with New York as a model, but other states like California following suit, I think many of the governors and the governor of Michigan also exercising strong leadership, the governor of Louisiana, the governor of Washington State. I actually think this crisis has brought out the best in many of our local officials. So the federal government has the most resources. They're the biggest. They are, the states are, but our Constitution is very different. Our federal government is a result of a partnership among the states. So there's a lot of power that are left to the states in our system. So I actually think the states are becoming stronger players, but are calling on our governor, strong governor, calling on the federal government to do more, to exercise more leadership. So I actually think it's going to emphasize the collaboration rather than the domination.
Great, Bill. We have one last question. Giovanna is asking you, in your judgment, do cross-sector initiatives in a period of crisis such as this one increase the threshold of governments related to transparency?
Yes, it can. And again, I think the questioner makes a very, very important point. And that is collaborations across sectors could potentially lead to a lack of transparency where public monies and public purposes are being carried out by private organizations that are not necessarily open to the view of the public in the media. And therefore, one of the things we say in our book is that public-private partnerships, cross-sector partnerships need to operate transparently. And the partnership, not necessarily the business of the social organization or the private organization outside the partnership, those remain private. But when they collaborate, when they come together to do something in the public interest, that partnership has to operate transparently. I think that's extremely important.
Wonderful. We have one last question. Do you have time, Bill, to answer?
Oh, of course.
Another one? Thank you. What will be the next most demand item for the scenario after the crisis? So should be this our main concern for now? Once this will generate jobs, so should we look already for the after crisis scenario and start working on that? What's your opinion?
Absolutely. Restoration is the fourth step, right? So we have, it's not a C, unfortunately, right? We have communication, collaboration, coordination, and then restoration, a return to normalcy. So right now in the Congress in the US, both the Speaker of the House, Nancy Pelosi, and the President are talking together about a multi-trillion-dollar public works program. It's been needed. It's been talked about for nearly a decade. But the politics stood in the way. They couldn't get together. I think, there's an old saying among politicians, never waste a good crisis. And the idea is in crisis, people come together who would never come together. Nancy Pelosi, I don't think the president had spoken to Nancy Pelosi for 45 days before the onset of the pandemic. Now they're talking about doing a $2 trillion joint effort on infrastructure. So I think that's good. So the next step is a return to normalcy. And then the final step is, transformation. How do we, once the pandemic has subsided, once the restoration begins, how do we do better next time? How do we, there was an office within the National Security Council to deal with pandemics. It was eliminated as a budget cut at the beginning of this administration 4 years ago. People said, well, there hasn't been a pandemic in many, many years. Why do we need to waste money on people looking at, maybe if we hadn't done that budget cut, maybe we could have saved thousands, maybe at some point, hundreds of thousands of lives. So one of the things we have to remember is just because the sun is shining doesn't mean it's not going to rain. And it may rain really hard. So yes, we got to get through the crisis. Then we got to get the economy back to where it should be. But then we got to think about how do we do better next time? And I think that's the cycle. Hopefully we learned something.
True. So, Tom, if you have nothing left to add, I guess in the name of the Global Center, I'd like to thank you, Professor Eimicke. This was amazing. Thanks a lot. I guess we learned a lot today, and it's a great way to end our conversation with the importance of getting together and joining forces from different sectors and different people. And this is our small effort to do that as well. And I want to let you all know we intend to keep doing these online meetings every week. So please join us, ask questions. This has been great. So thank you all. And I guess that's it. Tom, would you like to say something before we?
Just to say that we'll make available a summary of today's call, Laura, and form of a question and answer for those. And we'll try to answer those questions that have come on the line. There's been many questions asked that we didn't have time to answer, but maybe we'll try to take a stab at responding to some of those as well. And thank you very, very much, Bill Eimicke. We look forward. We've got many people on the line who are graduates of your master's degree program in public administration at SEPA, Bill. Many of them are on the line now. I know they join with me in thanking you for this. And there'll be my co-host when you finally do make it down to Brazil, which cannot be soon enough. But hopefully within the next few months, you'll be here in person and to talk about your book and to help us think through problems here in Brazil. Thank you. Back to you, Laura.
I look to join you next week in the audience.
Very good. Very good.
Thank you so much. Thank you, everyone. Be safe.
Thank
we'll
you.
get through it.